Hello, my name is Andrew Allard and I am one of the rheumatology consultants at the Royal National Hospital for Rheumatic Diseases, also known as the RNHRD, part of the Royal United Hospitals NHS Foundation Trust. It is my pleasure to welcome you to the Rheumatology Department. If it is your first visit, it is likely you will have been referred by your GP or another health provider. You will have received an appointment letter instructing you where the department is located and the date and time of your appointment. You may also have received a text reminder. The Rheumatology Outpatient Department has its own entrance located on the end of the RNHRD and Brown Sword Therapies building, furthest from the main hospital entrance. As you enter the building, our reception team are located on your right. It is important you let them know you have arrived, and they will check you in so that the clinician seeing you knows you are here. They may ask to see your appointment letter and take the opportunity to make sure that we have up-to-date records of your contact details. Once you've been checked in, please have a seat in our waiting area and wait for your appointment. We undertake routine observation assessments on all our patients, though these may vary slightly depending whether it is your first appointment and what your underlying diagnosis is. These might include measurements of height, weight and blood pressure. One of our healthcare support workers will call you shortly after your arrival for these. They take place in one of the rooms adjacent to the waiting area. If you've been asked to provide a urine sample, this will be collected from you at this point. Despite our best efforts, sometimes clinics run behind schedule whilst we try to provide our patients with the care that they need. We thank you for your understanding and patience. If you have any questions regarding the timing of your appointment, please do feel free to ask the reception team. When the clinician is ready for you, your name will be called and you will be escorted to one of our clinic rooms. This is an example of a clinic room. You will be invited to take a seat and the clinician seeing you will proceed to assessing your health as appropriate to your needs. This may involve asking questions about your health and undertaking physical examination as relevant to your symptoms. Once the assessment has taken place, the clinician will explain their thoughts and findings to you. You may need to have further tests as part of your investigation and treatment. Some of these, such as blood tests or x-rays, may be able to take place on the same day as your clinic appointment, and if so, you will be informed where to go. At times, this may not be possible, and for some tests you may have to come back another day, in which case you will receive a future appointment letter. The clinician will explain the next steps to you. At the end of your appointment, you should return back along the clinic room corridor to reception, where you will be able to exit via the same entrance you arrived through. If you have been prescribed medication to collect following the appointment, this will need to be collected from the main hospital pharmacy. The main hospital entrance is located to the left once you have exited the RNHRD outpatient department. The pharmacy is located inside the atrium, just inside the main hospital entrance. We welcome feedback, as this is invaluable to helping us improve our service. It is very helpful to hear about what you feel we are doing well and ideas about how we can improve our service moving forwards. Please feel free to ask one of our healthcare support workers or one of our reception staff about completing a short feedback form. Thank you for your attention.